Hi everyone, I'm Ashley with 9 Health, and this is Health Happens, our weekly Facebook Live show. We're on a quest this year to find where health is happening because we know it's happening to everyone, every day, whether you choose it or not. And here at 9 Health, we want to be your trusted source of information, of good health information and inspiration so that you can make the best choice for whatever your health needs may be. And today we're talking about getting medical attention, whether it be unexpected or expected. When you have an unexpected health need, how do you access the right care at the right level at the right time? And so today we're joined by Dr. Jill Goldenberg. She is an internal medicine physician from Porter Adventist Hospital, and she's here to talk to us about a cool new campaign called Where for Care. So that's what we're going to do today. Join the conversation if you'd like, if you have any questions about care that you may need to receive or where you should go for whatever particular condition you're experiencing. We're here with an expert, so we're here with the right person. Ask away in the comments below and we'll kind of chat in between. So thank you for joining us today.
Of course.
So tell us a little bit on what is Where for Care.
So Where for Care is a campaign and basically an educational campaign for consumers. So just like you said, and as the campaign suggests, we're trying to help consumers find the right care at the right time and at the right level. So the campaign really strives to educate consumers about kind of what kind of expectations they should have for healthcare costs.
Oh, good.
And then also how to kind of leverage their insurance plans to seek out the right kind of care for their needs.
Okay. So do you know how is cost of care? You mentioned the cost. That's a huge determiner a lot of times for people when they're figuring out where to go. How is cost of care typically determined?
So it's determined by a couple of things. So it's determined by your ailment, but also the facility in which you seek care.
Okay.
So let's take bronchitis, for example. So if you were to seek out care for bronchitis in an emergency department, the price tag would be pretty high as compared to seeking out care in an urgent care facility or primary care physician's office. That being said, we do want to remind consumers that you want to seek emergency department care when appropriate. So, obviously life-threatening conditions would be appropriate in the emergency setting, but we're trying to help consumers kind of sort out this complex marketplace.
And you do that with a really great tool on the Where for Care website. Whereforcare.org has a really great document that helps you plan ahead, right?
Yeah.
So can you tell us a little bit about that document?
It's a family care plan. So like you said, go to whereforcare.org. And it essentially has you lay out all your family members, some of their kind of big common ailments, put down, if you have one, your primary care physician or pediatrician. And then what I would suggest you do, and we actually did this in my household, is we called up our insurance carrier and we said, hey, if we need an urgent care, where would you recommend that we go based on our home and what would be best covered by our plan? And then we did the same thing for the emergency department. So now we have this document in our home that we can use, or our sitters can use, or their family members can use, so that we know where to go for the right level of care at the right time.
That's perfect. And as a doctor, you probably don't panic when things come up. But, for us regular folks, if something comes up, you can go to this document and just kind of have it all laid out. You know exactly what you should be doing based on what's going on.
Exactly.
That sounds great. So again, that's whereforcare.org. If you're just joining us, we're here with Dr. Jill Goldenberg. She is a physician at Porter Adventist Hospital, and she's talking to us about how to choose the right care at the right level.
Yeah, the right time. The right time at the right place. Yeah.
So I really like your messaging in this campaign. It calls out specific health needs and where you should go. So for instance, like a snake bite, where should you go?
Well, so for a snake bite, you should actually go to the emergency department. And the reason is that you might need some higher level of care. So you could have difficulty with your airway, you could have difficulty with blood pressure, and also you might need other kinds of things like antivenom. So that would be something that I'd recommend people go to an emergency department for, because that could be life-threatening.
Absolutely. Yes. So what about like pink eye? Where should people go for pink eye?
Pink eye, I think you could go one of two places. So you could certainly go to your primary care physician, or you could go to urgent care. But some of what might determine your decision is kind of the time of day. So urgent cares, while they generally do function during normal business hours, as do primary care offices, they often have some extended hours. So obviously, if you needed to get looked at sooner rather than later, you might choose an urgent care instead of your primary. But either would be acceptable.
Excellent. What about an ingrown toenail?
So an ingrown toenail, probably your primary care office would be fine, because
you can wait a little bit.
Yeah, yeah, it's probably something you could wait till the next day. In most primary care provider offices, once you've established, you can actually get a same-day appointment.
Okay.
So you could probably call the next morning and be
Another
seen.
great reason to have that primary care physician established and have
Yeah.
someone that is your go-to person.
Exactly. So,
Have a need.
yeah, so as a primary care physician, of course, I'm a little bit biased, but that aside, right, everybody should have a primary care physician for your overall health, for preventative screening, but also kind of once you're in the door, you can always call and often be seen the same day for an urgent need, not an emergent need.
Absolutely. Nancy says, good morning. Good morning, Nancy.
Good morning.
Again, if you have any questions about specific health needs that you may have and you're wondering where you should go, or you want to do some pre-planning, feel free to ask us here. We'd love to. I'm sure Dr. Jill would love to help you out a little bit. So you mentioned time of day when deciding where to go. Are there any other factors or questions that people should ask themselves when they're deciding
where to
kind of care to
go?
receive? Mm-hmm.
Yeah. So, I mean, I think like we've already emphasized, so anything that's life-threatening and is an emergency, obviously call 911, go to an emergency department. But when you're talking about things that are, less urgent, you should think about, again, if it's business hours, you have a primary care physician, that might be the first place to go. If you need to seek out an urgent care, if you can, what I'd recommend you do is flip over your insurance card or actually go on the Wear for Care site. We actually have a lot of websites available and phone numbers for the various insurance carriers, and actually call, the nurse triage line or call your carrier and find out which urgent cares or facilities would be best covered with your insurance plan.
Excellent.
To kind of
have that plan
Yeah.
ready to go.
Yeah.
What about if you're not in your hometown? Do you have any different recommendations?
I think the same thing. I think your insurance carrier can once again help direct you. So again, if it's not an emergency, I would take that time to pick up the phone and do a little bit of investigating, such that you go to the right place so you don't end up with a big unexpected
Kind of like
cost.
something you do before you leave town is like your travel preparations. Take it to that level.
You could. I think
You're
if you
a
have
super planner.
right, and if you have things that you think might come up, that might not be a bad recommendation.
Okay. So I have a feeling I'll know what you'll say to this, but what if someone doesn't have a primary care physician? What's their next best option? I mean, obviously they should have a primary care physician.
Well, so I think if they need something kind of urgently that day, that might be something to go to an urgent care for. But as we talked about, I would recommend that everybody get a primary care physician. And again, I would really leverage your insurance carrier. So call the number or go on the website and help them find you a provider that's, local and close to your home or your workplace, and let them drive you to somebody that's covered under your plan.
Absolutely. Okay. And again, if you're just joining us, we're talking about the organization or the campaign called Wear for Care, and it aims to just direct people to the right type of care that they need at the right place at the right time for the right cost too.
Yeah.
And that's important. Are there any common misconceptions or myths about care that might be received at these different levels, or anything that you could dispel here?
Yeah, well, I think when people worry maybe a little bit about urgent care and are they going to see the right type of provider? So urgent cares are staffed with physicians, they're staffed with advanced practitioners, so nurse practitioners and physician assistants, so they're really equipped to see urgent care matters. People probably also have concerns about, will their insurance be accepted? Most urgent cares and emergency departments do accept all carriers. But again, if you've got time and it's not a medical emergency, picking up the phone, calling your carrier, and finding out what facility would be preferred is typically in your best interest. People worry at emergency departments about wait times. And that's a valid concern, but actually our emergency departments really strive to move people through very quickly. You can actually go online and Google almost any of the emergency departments in the city and find out what their wait time is. Additionally, I'd be reassured that if you come in and you've got chest pain or anaphylaxis or something really emergent, they're going to shuffle you back and take care of you first. So those might be some of the myths and things people worry about.
Absolutely. And this might be just a question of my own, but how do you know when to call 911 and when to go to the emergency room? Like, is there, can you drive yourself or should you have an ambulance take you?
Right. Well, I think if you have to even ask, should I drive myself? You're probably calling 911. Yeah. And part of calling 911 is they can probably help instruct you to some extent. But certainly, if you're feeling like you're having a life-threatening emergency, it would always be advised that you call 911 as opposed to driving yourself.
Excellent. Well, if we don't have any other questions coming in, thank you, Nancy, for chiming in. We're going to wrap this up, but we do want to make the announcement that It is August 1st, so as promised, our Find a Fair dates they did go live this morning, so find a fair near you for our fall fairs at 9healthfair.org. And again, whereforcare.org is a great resource to do some pre-planning with your family if you need to figure out where you'll need to go for care if something unexpected comes up. A great resource, not only just to Coloradans, right, but anyone, really.
Yeah, absolutely.
Anyone across the nation. So thank you, Dr. Jill Goldenberg, for joining us, and have a great day. Thanks for joining us.